Right. Well, it's the noon hour. It's time for our final session of our National Strategy Learning Collaborative. My name is Cheryl Donnell, and I've been facilitating this series with Jill and Susan in my back pocket to help us be successful with all of these sessions. If you just joined us, we're asking you to put your name and organization in the chat so that we can greet you and see that you're here. If you haven't had a chance to change your name or can, as Jill just mentioned, you can click on or you can go to the dots on your um, image and be able to change your name so that we know who is talking to us from what location. If you're on the phone, you may have to just shout it out or let us know who is on the phone because I've got one phone number here of 920 ending in 751. I don't know who that is. So identify yourself as much as possible. Okay. All right. Well, Jill, do you want to get started with our slides for today? Bring those up.
Okay,
Wonderful.
can you see them okay?
Yes, I can. I hope everyone else can as well. We're going to go ahead and welcome everyone again officially to our Learning Collaborative. And we are going to be having quite a bit of discussion. So I hope all of your mics are working. We'd love to see your faces too if you want to uh, use your video so that we can see your faces. But we will be also using the chat function today for part of our meeting. So let's go to the next slide. We'll go over our agenda. All right, so today, Jill's got some announcements that she wants to share with us, and we're going to be going over some of the polling and survey data results that we've gained from our Learning Collaborative. And then we're going to have our breakout discussion groups. A discussion guide was sent just early today. So hopefully you've got that. We've got some facilitators that will help us with our breakout group discussions, but we're hoping that you will be feel comfortable after now doing these discussion groups in sharing kind of some of your thoughts and feelings. And then we're going to get into a section on a request from ACL to talk about some of the recommendations we have for our RAISE and SGRG councils. So we'll be reaching that point later in our meeting today. Next slide, Jill.
Um,
Jill, do you want to, we'll let you go through our announcements?
yes, that's my cue. Um, Again, many of you may have seen the announcements I'm about to make in your email inbox folder, but it's always helpful for me to call them out to your attention. As you all know, we're hosting the 2025 National Lifespan Respite Conference in Huntsville, Alabama, in collaboration with Alabama Lifespan Respite. And the call for presentations is now open. I would strongly recommend that you're, as a grantee or as a state respite coalition, you consider submitting a proposal to present on any of your lifespan respite grant activities or your state respite coalition activities that we can feature in our lifespan respite track at the conference. The deadline right now is October 1st. We're trying very hard not to extend that date for proposals. So if at all possible, if you can get that proposal into us in the next month or less than a month, 3 weeks, that would be greatly appreciated. I'll put all these links in the chat too once I'm done sharing them with you. Another call that we have open right now is our national call for recognition by Arch as an innovative and exemplary respite service. We've been doing this almost annually since 2019. And if you know of any programs, if you yourself are running a respite service that you think might be innovative or exemplary and meet our pre-screening criteria, please consider applying for that. Unfortunately, the time is exactly the same as our call for presentations for the conference. So I know it's a big ask to make at this time, but again, please share this information. The deadline for this will be October 8th, and we will not be extending it beyond that date. That's a pretty firm deadline. If you missed, Susan did a wonderful information session yesterday on what's involved with the application process and what does it exactly mean to be an innovative and exemplary service. So if you missed that session, the recording is now available at the link. And you can just read more about the whole initiative and how to apply on the Arch website as well. And then finally, a brand new announcement. You all may have seen it a few months ago. We did announce it in our Respite Research Consortium update. But we are going to hold our second Respite Research Summit. It will be virtual at the end of October. It will be the afternoons of October 28th, 29th, and 30th. And we are super excited about this because we have some really amazing presenters that are going to be with us, including some of our members of our Committee for Advancement of Respite Research. But many of you know there are some major new initiatives out of the administration around respite, and we've managed to corral the folks who are doing the evaluations for those big initiatives. One is the guide model, the Medicare guide model, that for the first time, traditional Medicare will be paying for respite outside of hospice in that model. And we're going to hear directly from the evaluator for that effort. I'm very excited about that. We also have the evaluators from the new Center for Dementia Respite. ACL funded a huge project with the Alzheimer's Association and other partners to fund innovative respite initiatives for people with dementia around the country. And we've got the evaluators, both of whom actually serve on our committee for advancement of respite research, but they've agreed to talk about their evaluation plan for that. So it's just going to be a really incredible event. We're also going to feature 3 of our innovative and exemplary respite services who participated with Arch in doing an evaluation, a 12-month evaluation over the last year and a half or so, with a lot of technical assistance from Susan and Cassandra. And we're going to hear about their evaluation results and how evaluation and research can be accomplished by local program providers and how to get more engaged in that effort. So please feel free. There's no charge for this event. You can come to one afternoon or all 3 afternoons, and you can read more about the program agenda for each of the days on the website link. So I hope you'll all be able to join us for that. And again, I'll put the links to all of these in the chat for you.
All right, wonderful. All right, so I was just responding to somebody about the presentation today. I want to thank you for your participation. I want to give a sincere thanks to all of you for your participation in this learning collaborative. We got 19 responses to our feedback survey and have had 121 individuals representing 29 states participate in one or more of our learning collaborative sessions. And a shout out to Rosalind Albert in Washington and Lita Nelson in Arizona, who both tied for attending 13 of the 14 sessions prior. So we're grateful for their steady involvement in our learning collaborative. We also had 25 brave souls who were willing to take an assignment in their already busy lives to help with one or more of the learning collaborative sessions. These guest presentations from Lifespan Respite, our respite colleagues, the presenters were considered very helpful by 78.5% of our respondents in our survey. And we do benefit from a very strong peer mentoring practice among our lifespan respite program. So none of you need feel alone in this work. Thank you, Susan Summers and Cassandra Furman, Lisa Snyder, Corey Lutz, and Kathy Mayfield Smith, who helped to facilitate some of our breakout sessions. And thank you, Jill. And also Megan Cluth for all of the hard work that went into this learning collaborative. It's been an honor to work with you guys all. Next slide. So as you well know by now, the National Strategy to Support Family Caregivers was developed jointly by the advisory councils established by the Recognize, Assist, Include, Support, and Engage, or RAISE, Family Caregivers Act, and the Supporting Grandparents Raising Grandchildren, or the SGRG Act, with extensive input from family caregivers, the people they support, and other stakeholders. And the Administration on Community Living, or ACL, leads the implementation of the RAISE and the SGRG Acts and facilitates the work of those two advisory councils. And they also administer our lifespan respite grants that support our activities. So almost 3/4 of the participants in the Learning Collaborative were our lifespan grantees, and 37% were tied to state coalitions. So we had great representation. The 2022 National Strategy to Support Family Caregivers includes an abundance of important, relevant information and guidance to support caregivers, and proposed hundreds of actions that states, communities, and others could take to improve the lives of family caregivers. Awareness about the national strategy was initially low at about 42%, indicating that they were not familiar with the goals, objectives, and recommendations under this strategy. And upon first hearing about the national strategy and the launch of this learning collaborative, the most interesting goals for the lifespan respite programs were focused on goal 3, strengthening services and supports for family caregivers, and goal 5, expanding data, research, and evidence-based practices. Now, goal 3 holds the most objectives that respite would be associated with, but all of the goals hold some relevance to our lifespan respite activities. And in reviewing the national strategy, however, there were two main reactions: excited and also overwhelmed, even though participants saw that their respite grant activities had some or significant alignment with the national strategy. The question was, is lifespan respite ready to take charge on leading out efforts on the national strategy? And while ARCH and ACL were confident, each lifespan respite program needed to look at how national strategy goals and objectives fit into their state grant activities. So next slide, please. To respond to this question, 83% of the Learning Collaborative participants completed a review of the national strategy, and 50% selected recommendations to work on, while another 58 were engaged in conversations with others about implementation. So immediately started working on that. But also, after reviewing the strategy, 33% of the participants in our Learning Collaborative reported that they were taking a leadership role on awareness and outreach recommendations. Another 33% were working to strengthen services and supports for family caregivers, and 29% were working to build partnerships and engage family caregivers more directly. So building partnerships will likely be needed in all areas, but a special emphasis on new partnerships and community connections that would hopefully result from this learning collaborative. So as you think about those new connections you're seeing develop, share those as we have our discussions today. After attending the Learning Collaborative, 68% of respondents said that they had gained significant improvement in understanding the content and purpose of the national strategy, and also felt their participation in the LC was valuable. However, learning collaborative participants were juggling multiple activities and roles besides the national strategy implementation, of course. And so 50% of them struggled with managing interruptions. Another 25% struggled just to find time for it and schedule that into their ongoing activities. So national strategy implementation kind of felt like an add-on rather than an integral part of our work. And I'd like to hear more about why this might be. Although attending the Learning Collaborative has made 42% of you feel a whole lot more confident about your leadership role, 61% of participants said they were just beginning to work on some of the motivational and educational interventions that were necessary to prepare their state for change related to the national strategy. 29% said they had progressed to working on enabling or skill building interventions to help enact those new practices around the national strategy. And only 11% felt they had progressed to a point where they were reinforcing kind of the structural and financing interventions that would help to sustain the changes made that align with the national strategy. And so we had some data collected back in February 2024. And since updating the matrix on your activities around the national strategies, it'd be interesting to know where you think you are currently in implementation. Strategic implementation can be a prolonged process. So identifying kind of some milestones along the way that you can help celebrate and record that progress from where you started to where you are now. And so remember that as a little refresher, change occurs over time through kind of 3 stages of implementation. The first stage we kind of referred to that motivational and educational interventions that help prepare people for change. And this stage kind of helps unfreeze them so they can move in a new direction. And people kind of need the right mental and emotional state to allow themselves to move forward and change. The second stage is more the enabling or skill building interventions just to enact a new practice. And this phase is where people kind of receive the support they need so they can make the change into a new desired state. So removing barriers to access falls in here, and getting people to move through a process to achieve outcomes is kind of in that second stage. And then finally, we want to refreeze all the changes we've made with the process and the policy, the structural or financing interventions that help to sustain these changes long term. And we encounter silos. So, right, we know that they seem frozen in place. Changes that we're making will also need to go and be kind of cemented in our systems. And refreeze means to anchor or set that change more permanently. So I've got a polling question for you that I wanted you to look at about the status of any changes to the national strategy goals and recommendations in your state. Where are you? One, preparing for change still through educational and motivational interventions. Is that buy-in still being sought? Number 2 is enacting new practices of change through some more of those enabling skill building interventions. So working systems differently or in a new way towards objectives. So moving into those new practices, or are you kind of in that reinforcing that infrastructure to sustain change through policy structure and financing intervention? So have those changes cemented into a new way of doing things. So we'll give you a chance to respond to that. Great. I'm seeing about 41% in that first phase, 35%
Is
in
everyone
the
done
second
voting?
phase, and 24%. Oh, okay. Let me see. We've got
There's
18
still
of
a
you
couple of people voting, Cheryl. Give them another minute, another second.
for sure. They're thinking
So,
about it.
yeah, I just saw two more added, so let's give it another 5 seconds.
Okay, very good. Then we can share the results.
Can you see those?
I can't see them on my end, but I think it's 44% on the first phase, 33% on the second, and 22% on the third phase. So thank you for sharing your thoughts about where things are right now. Okay, guess everyone's had a chance to look at that. I'll work on the next slide, Jill. Okay. So our breakout discussion groups were considered very helpful at 63% of respondents, and we're going to engage in some more group discussion today. And we have some discussion questions that have been distributed, and I hope that you'll take a moment here just to think about these questions as I read them off. How prepared and ready are you to take leadership on implementing one or more of the national strategy goals in your state? Do you know where you're going and how to get there? If not, I'd like to hear about that too. What tools or resources would help you sustain your leadership efforts? You know, outside of cloning you, what could help you create more other leaders or share the work in some way? Think about those tools and resources that might be needed. We've explored many different topics in the National Strategy Learning Collaborative sessions, but what additional information or supports would be helpful to you as you continue your work? Um, at this point, moving forward, what do you wish you had a better understanding of, or what information or support could you benefit from? And then just what else would you like to share about your experiences gained in working on the national strategy goals? What has resulted in wins, or are there new barriers that you're experiencing that you've got to now cross? Um, how integral do you see the national strategy goals in your work, or is it indeed an added responsibility? Uh, and just another leadership hat that you wear. So we are going to go into our breakout groups, and facilitators, please remember to record your sessions. And we appreciate you joining and sharing in those sessions. So we'll get set to our various breakout groups.
Lisa had one comment in the chat that might be worth discussing before we go into the breakouts. About coalitions differing from the grantees and understanding what's happening at the state level.
True, we may not have the greatest communication between the different partners, the lifespan grantee versus the coalitions, but we have discussed the national strategy goals enough that I think that even if you don't know where the state is, you in your own leadership can talk a little bit about where you see you're moving forward on those national strategy goals and objectives that have been proposed because of the role that you're having. Does that help, Lisa?
Yes, and that is what we've done with our coalition. I know exactly where we're at. We've tied all of our programs to see where they fit with the national strategy. I just don't know what's happening at the state level. So I was reluctant to answer the question because I didn't want to give the wrong answer.
Yeah, and you may not know. That may be something that is not clearly communicated at this point, but you know what you're doing, right? So share what you do know about what you're involved in, whether you're the grantee or coalition member or other partners. So hopefully that helps. Was there any other questions? Okay. great discussion, and I appreciate everyone's participation in that. So let's go back to our slides, Jill. Yeah, can you go to the next one? All right. So obviously, we've been working on national strategy goals and objectives, and this meeting is really just an opportunity to reflect on the work and progress that you've made in achieving one or more of these goals. So we know that you are maybe working on multiple goals or objectives, but for our next activity, I want you to pick a goal that you'd like to address. Maybe it's something that you are particularly directly involved in, so as we ask a few questions. And we're going to, instead of doing a breakout, we're going to use our chat function. If you don't have access to the chat function, but can raise your hand or just jump in, we're going to ask you a few questions. And as you think about one of these goals that maybe you have recognize your particular role in, I want to ask you to think and respond in the chat one or more of these questions that you would respond to. Thinking about that particular goal or objective, can you identify the key challenges that you've encountered? Thinking just about the challenges. Put a quick message in the chat about what were those challenges that you've encountered. They may be old established ones or they may be new ones, but just thinking about what is a challenge, that a barrier maybe that you've encountered. Just stick it in the chat for me.
Cheryl, if people wanted to just unmute themselves and
They
share,
could.
could you do that as well?
We
It
want
might
it's
encourage
hard to
others to engage.
it's hard to type and talk at the same time, so I want to capture it because we may not have time to hear from everyone for the moments that we've got scheduled for this activity. But if you have your hand, Barb, you've got your hand up. Go ahead. Mute yourself though.
I don't think I do. Do I? Oops.
You've got your hand up. Did you want to kind of respond to that?
No,
Those
I
key
think
challenges?
I think that was what you call a pocket reaction. You know, like a pocket dial. Sorry. No.
All right.
I'll put it in
All
the
right.
chat. Thank you.
Okay, all right. Just type away on the chat, thinking about those key challenges you've encountered. And then the next question is to maybe identify the some specific conditions or the essential resources maybe you need to continue to fulfill this goal. Thinking about those specific conditions or essential resources needed as you work on that particular goal. I'm seeing some excellent comments in the chat. Thank you. If you had that magic wand and could create an environment where you could move forward on these goals, maybe there would be a champion that was identified, or maybe there would be somebody with additional language skills that added to your staff, whatever you think might be a specific condition or resource that you might require in your work. Okay. Not seeing anyone's hand up. I love the chat. Keep it coming. As you're thinking about those resources? What would need to happen? How about any specific recommendations that you would make to help you address some of the challenges or to better support your work? If you were going to make a suggestion to your state, locality, federal level, is there something specific that you would like to suggest? Maybe to help address those challenges or support your work better?
Cheryl, this might be too much to write, but in Rhode Island for the Lifespan Respite Grant, our grantor, the Office of Healthy Aging, actually brought agencies from several fields. So they brought together nursing schools to provide the respite services. They've brought together social service agencies like my own. And they also brought together an agency that does data collection, data review, and also outreach to medical facilities. So it's been a really good partnership in terms of trying to break down what I wrote as far as the challenges, to break down silos.
That does sound like you've made some movement there, definitely. That's wonderful. And what an exciting opportunity to bring all these people together and have a common goal, objectives that serve everyone, give them wins, but that also help.
Yeah, and we also brought together Catholic Social Services with us. So the perspectives when you witness a meeting that we have are just from many different backgrounds, and it makes it really interesting and really more accessible for other community agencies that would like to join because we're already diverse.
Mm-hmm. Okay. Well, let me ask you another question. What else would you like ACL to know about your experience working on the national strategy goals? As they look to the lifespan respite programs to take some leadership, would you want them to know? What would they benefit from understanding from your perspective about your experience working on national strategy? Oh, okay, great ideas. Keep them coming. Some of our states are well-staffed, others are one person carrying the load. But ACL is trying to be responsive, of course, and the councils in understanding the work from our perspective. So if you have anything that you could share, how exciting it is to see some movement, or talking about, the idea that there is something both at the federal, state, and local levels that can be done. So thinking about that. Great comments.
I do like the people even doing the reactions to the comments because it shows I've got that need too. I've got that need too. I've got that need too. I think that's demonstrative of those challenges as well.
Yeah. Thank you for all of those thoughts. Let's go ahead and close this section down and go to the next slide. Thank you. We're gonna save all of these comments in the chat. If you have more, absolutely, please bring them up. As I was going through the materials generated by the Learning Collaborative, and I was able to identify some of the wish list kind of items that people felt would really lend to their efforts on the national strategy. And ACL has specifically asked us to provide them with some recommendations for their councils. So that's the RAISE Council, Family Council, and the grandparents, the SGRG, Grandparents Raising Grandchildren Program, and Council. And so as we think about kind of some of these things, I was going to just throw out the ones that were jumped out at me, and obviously needing to be able to break down those local or state silos between agencies, the geographic areas of our state, etc. Several states have talked about the efforts to reduce silos among their partners, and Christina was just talking about how they had seen some movement on breaking down those silos and working together. But as you think about those partners, due to different populations that they serve or the funding streams that they're dealing with across the lifespan, and so while some shared some progress. Obviously this is recognized by many as an ongoing challenge, maybe to articulate what is that recommendation that we would want to send up regarding breaking down those silos. Any thoughts? Maybe you're putting it in the chat, sorry. If you have some thoughts, if silos are an issue for you as well, put it in the chat or raise your hand. All right. One of the other ones was that new people need to know how they can contribute to this work, and but maybe do not feel like they're up to speed and or even needed or acknowledged in their role, and so maybe needing to look for a shortcut or some information about the national strategy. Somebody recommended like having a one-page tool to onboard maybe that new person, that first timer who is joining in a collaborative effort on the national strategy, to know what's needed and how to help. Maybe recognize what their role is, whether it's connecting with caregivers directly, targeting a specific population that is underserved, etc. So that was one that came up. Does that sound like something that others identify as a need? All right. If you haven't, I don't see any hands. So if anyone had some thoughts about what that might look like, or how that could be
I
described.
did actually have my hand up, but
Oh,
I
I'm
took
sorry,
it
I
down
didn't
just as
see
you were
you.
saying that. That's okay.
Oh, I
don't wanna
didn't. Go ahead.
I don't want to get
Go
into
ahead.
extensive detail again, but going back to maybe information from the breakouts, if notes were taken or something. I really did talk about a crosswalk being developed with the strategies and how they connect to other requirements and reporting programs, et cetera, so that people are more able to work together and not recreate the wheel each time a strategy is identified in a different program. And I think that would be very helpful in breaking down the silos and in getting people up to speed faster.
Okay. All right. Well, thank you. I'm sorry. I'm not catching everyone's hand. Let me look here and make sure that I haven't missed anybody. Any other thoughts? Does that sound like something others would be interested in? If so, if you have any thoughts, just put it in the chat. We'll add to the information we're gathering there. One of the other things that was in the Learning Collaborative notes were just that need to connect with to people who had connections maybe with our caregivers, so faith-based or the 55 plus active adult communities, or somebody who's already doing things, maybe connected to caregivers in those communities, that don't realize that they're working with family caregivers, but may benefit from knowing how to support the people in those communities. And so one of the things was just to continue kind of the more of an old-fashioned approach to having maybe community events in areas, rural areas, maybe where introductions and grassroots level relationship building happens kind of over a cup of coffee. And so thinking about how to connect with people, what's the best way of doing that? Do we need to have maybe some recommendations that will help us in building those relationships with a broader caregiver population or specific targeted areas of caregiving? If you have any thoughts about that, I'm gonna breeze through here and see if I see any hands. Okay. If you have thoughts, please share them in the chat. Building new partnerships, especially as a leader, you're forging new relationships and partnerships, maybe looking outside the box a little bit. And how do you do that? Jill had mentioned maybe at one time business roundtables, maybe at a state level, or we're bringing in insurers or employers or the private in addition to like the public practices, and helping to fill those connections. So who are the people that we're not maybe thinking of, the people outside the box, if we can identify? And I think we have in some of our sessions identified some of the new partners maybe they're bringing to the table. Would there be a recommendation along that on helping to identify what exists in one state and what maybe could be pulled together in another? Sometimes we have to think of how outside the box to be able to even bring in those new partners and see a role for them, because they're not a respite provider necessarily, but maybe they are counseling and working with families, in private practice family therapy, or they're estate planners and they are dealing with families who are trying to put their estates together, and they don't have answers to some of the challenges that those family caregivers might have, and their partnership with you might be the bridge that's necessary to connect with those caregivers. So thinking about those new partnerships that could be developed. As part of our report, ACL is asking for recommendations to improve respite, based on the work of the Lifespan Respite Network. And this learning collaborative session is just really that opportunity to introduce or emphasize the national strategy goals and objectives that Lifespan Respite grantees and our partners would like to see reflected in the future work and priorities that the ACL councils are engaged in. So, as you're thinking about where do we go next, what are maybe some of the future steps or priorities that you would like to see particularly emphasized in the national strategy and recommendations, and that maybe the ACL councils would then champion? It would also be an opportunity to provide, maybe reflecting on your state's experiences and activities, identify some of the gaps in the care and support of family caregivers, and maybe to suggest any areas of improvement that we could make even to this plan. So the ARCH report on the National Strategy Learning Collaborative can help maybe lend support to those ideas and those strategies that will help to improve future outcomes under our national strategy plan. Any other thoughts that have come up in your minds about what we would want to see maybe more clarified or elaborated on in the national strategy, or specifically some We're getting some comments in there about care workforce. Obviously, that is one of the goals in the national strategy, to build our direct care workforce. And capacity. So, maybe capacity means adding new programs or tailoring programs to specific populations. We tend to say we have a cookie cutter approach to respite. This is how we do it. This is how it works. This is what we're comfortable in doing. And yet, are we willing to change how we deliver respite to meet the particular needs of family caregivers that otherwise can't access it? Jill, did you have any other thoughts that you wanted to share?
Well, I was just thinking, if any of you have specific grant or coalition activities that have been very successful in your state that you think would be replicable across states, that we would want to recommend be adopted by more states. The more specific, the better. For example, I saw a recommendation here about using community health workers. So the extent to which you have specific, there were so many activities in the national matrix that you added, your activities that align with the goals of the strategy, but are there any that really stand out that we're putting forward all of your activities to the councils, but if there are some that you feel very strongly about advancing through the national strategy, I think the more specific we can be, the more helpful the recommendations will be. And I hate to put Lynn Gall on the spot, but she is a member of the council. So Lynn, if you have any thoughts about what kind of recommendations or what level of specificity would be most helpful for you as you work on updating the national strategy, that kind of insider information would be really useful. If Lynn is still with us.
She's still with us. Well, one of the things that we've heard a lot of success on is self-directed respite programming, and yet that is often siloed into maybe our Medicaid managed care or whatever systems. And yet I'm wondering whether or not looking at some of those self-directed approaches more broadly would be an important recommendation, so that it doesn't get stuck with you have to check all these boxes to benefit from a self-directed approach. Anyone have any thoughts about something that maybe needs to be applied more broadly across programs, or at least have them address how that model doesn't work for them for whatever reason?
I would be a fan if we could do that in Washington State. But however, I would be more of a fan if the pool of respite providers and the way we recruit respite providers and lifespan were much more in alignment. I think everyone would be like, yeah, let's be patient-centered and let's be caregiver-centered, and let's put the ability with the person who needs the care. But just from feedback I've received over the years running our voucher program, there's a lot of caregivers find it very, very difficult to navigate to help the people they're caring for find a qualified respite provider based on the registry that's around right now. Now, this is only anecdotal. That's not a confirmed study. It's just what I'm hearing. And so it just leads me to think that it's not the concept of it, but it's the, you know, and it isn't even like, yes, there are lots of different qualifications, and this is true with all of our silos. But I think to make it really happen, what the person is going to need to become a self-directed, hirer of providers, there needs to be consistency in terms of qualifications, like this training program that just came out, for example. I'm not saying that would fly where we are, but I'm just saying that it makes it really difficult, because right now people go online and they sign up and they pass a bunch of tests and things, and I don't know, it's very odd. There's some real oddities going on in the system.
Well, certainly are ramping up, and to get people to respite, we go put them through a whole lot of hoops, don't we? We have an application process and a matching, and we have to make sure that, there's certain documents, doctor's reports, or some evidence of eligibility. Then, then it's a matching process with a provider. And sometimes there's quite a long delay. And so shortening that period from yes, I'm ready for respite to yes, I've received respite is kind of an ideal thing to shorten. Figure out ways to streamline that, shorten that process so that people are actually benefiting from respite a little quicker. One of the things that we're seeing in Nevada, and I don't know if it's something that others have seen, is because we're having such a workforce shortage, um, they have made it much easier for what they call a consumer directed approach to hiring their family. And guess who gets hired to provide those services is the family caregiver that we're trying to get respite services to. And yet I've asked, I said, do you even allow that family caregiver? You've hired them now, so you're off the hook, state. You've got the worker in place to provide the supports to that individual with special needs. But that's the family caregiver who gets them 24/7, and you're paying them for a limited amount of hours. Are you also guaranteeing that that person has access to other providers in that system who could provide them with a respite break, as as a given that they are getting able to tap somebody else? If you're hired by an agency to provide care to your loved one, are you getting to be matched up with others who could back you up if you're sick, who could help you, in any particular breakdown of your health or your ability to provide care? And does that extend to respite services, to those necessary breaks for the family caregiver? And it worries me that the state says, well, we've got it covered because we've got all these employed family caregivers now. So we're meeting our workforce demands, but we're probably not thinking about the respite needs of those family caregivers now that are employees.
Cheryl, I couldn't agree more with you on that. This has been a concern of mine since we started talking about paying family caregivers to be family caregivers. So many states have then eliminated their eligibility for respite care when they become paid providers. So I think this would be a very important recommendation for us to make, that as we move toward paying family caregivers to fill the direct care workforce gap, that we still make sure they have access to caregiver supports and backup respite care. That they probably need it more than ever now, because they're going to be providing even more care than they were before.
Mm-hmm.
I don't know if the rest of the network feels that way, but
yeah. As we come to the end of our session today, I'm going to give you just a few minutes to put any other additional thoughts that you might have, or raise your hand to say, I agree with this, or here's what's happening in our state, that that maybe a more federal level look at how states implement certain things might be beneficial. But we want to give you just a moment to get all your thoughts down as we come to the end of our meeting today, and are so grateful for your input into this process as we try to move some of these national strategy goals and objectives on. I don't know if there are any that that you've said, you know, we don't work on that, so it's not an area that we worry about. There's many goals and objectives that are part of the national strategy that may not be ones you are specifically looking at, but as you are talking with family caregivers, there may be other maybe not necessarily related to respite that you know are a burning issue that the councils ought to be looking at. If not, I guess, oh, did we have somebody's hand? Let me look. As always, you know, if you come up with some thoughts that maybe didn't gel while we were having our meeting today, please send them to us. Jill, you want to put up our contact information for those that don't know how to reach us? We'll then give you a chance to put your final thoughts in the chat. And then thank you again for your participation in this learning collaborative. I hope it's been as beneficial to you as we and to those that you're working with as we could possibly be in the time that we had together. This is the last session of the National Strategy Learning Collaborative, and we will not be meeting again, but the report will be worked on and sent to ACL as part of our wrap up of our activities. So thank you so much for your participation and your willingness to share just your thoughts and feelings about the national strategy and your role within it. And if you by chance missed any of the Learning Collaborative sessions and would like a look back at any of the topics that were covered, those are all available on our ARCH website under the Learning Collaboratives, and you'll see implementing the national strategy. And you can certainly pick up any that you didn't get to and miss by some chance. So thank you very much. Jill, do you have any last thoughts that you wanted to share?
I just want to echo my great thanks for all of you who spent so much of your time working with us on the National Collaborative and contributed the great work that you've done. It was incredibly heartening to be able to hand over that national matrix of all the wonderful activities that you're already engaged in or planning to be engaged in that help advance the national strategy. And I think that matrix is going to be incredibly useful as they work to build up the respite actions in the new revised national strategy moving forward. But again, I offer this in our breakout session too. If just because this is the last formal meeting of this collaborative doesn't mean that we're going to stop working on these issues. So if at any time something emerges that you'd like to learn more about, like us to hold a special session on, we're more than happy to do that. If anyone needs individualized technical assistance on anything that they're working on, ARCH is also available. And again, I commend you to all your wonderful colleagues in the network who are now all experts in their own right on many of the issues that we talked about today, and that you should feel really comfortable in reaching out to each other as well for guidance and expert activities. So thank you all again. And this doesn't necessarily mean it's the end, but we look forward to continuing to work with you as needs arise.
Right. Thank you. This learning collaborative was a a tool to help you prepare to take on that leadership role on the national strategy, not the end, not the end of your role in moving those objectives forward. And so obviously the effort is going to continue and will be integral to our work with the Lifespan Respite Network as well. So I just wanted to thank you all again, Jill and Susan. Thank you for helping to facilitate today. We will be getting the meeting notes from this session prepared and delivered here in the next couple of days, and the breakout sessions and stuff will also be posted on the Arch website as we conclude this particular learning collaborative meeting and session. It'll be where all the other ones are listed as well.
I want to take one more minute too and just thank Cheryl for the incredible facilitation that she did of this collaborative and being a leader in her own right. We had the premier teacher to talk about leadership skills. So thank you very much, Cheryl, for all your time. And I'm hoping this won't be the last we see of her either.
All right. Thank you. Enjoy the rest of your afternoon, evening, and we'll look forward to another time when our Lifespan Respite network gets together, and particular upcoming events that we have that we're going to be looking for your participation in. So good work, everyone. Thank you for your comments, and we will let you get back to the rest of your lives. Thanks.
Thanks, everyone.
Bye-bye.